Thank you. Oh, I have to say something there. Great. Thank you, and thank you all for this opportunity. I am going to do the best I can to make this as clear as possible, but there will be some redundancy and there are topics that get left out, and I will talk fast so that I make sure we get to the videos that Teepa Snow made for us, at least one of them. So if you have questions, if you ask, either put them in the chat and Colleen will monitor them, or just save them to the end. That would be preferable. So I'm going to start by showing you bits and pieces of my screen, which has the PowerPoint. So I want to talk today about traveling with dementia, and we have both air trips and day trips. So some of the information and the tools that we've developed are applicable to both situations, and some are specific for only day trips or local trips or air travel. All the resources that we have will be available to you. Let's see if that works there. On the websites. So this is the address for the Dementia-Friendly Airports Working Group website, and also the Gmail account if you have questions. And then some of the information also comes from the Roseville Alzheimer's and Dementia Community Action Team, which we call Roseville AD. And you can see our webpage and our Facebook page, and again, an email account. So if you have questions or you're trying to find any of these resources, these are places to look for them. So the first thing I want to talk about is, why do people travel? And I'm sure that you know the reasons. So there are reasons for local travel, you can read those. And there are reasons for air travel, which include vacation, family events, business, still, some people are still in business, medical treatments, and relocation. So what are the concerns if people are traveling? And I'm going to go over these in some detail. Doesn't matter what kind of travel, one concern is that you get separated from or you lose your care partner or your travel companion. Keeping track of your stuff. How do you manage whatever it happens to be? If you're in the airport, how do you navigate, get from one place to another? The signage is often confusing, wayfinding is difficult, and it can be noisy, and it's just difficult. And our airport is often under construction, so that just complicates things. And if you've gone someplace else, not the airport, how do you navigate that site? How do you get the assistance that you and your care partner need? That's a very important question. And that's actually come up now for an airports and airlines committee that I'm on. And I'll bring that up again in case people have some thoughts about it. How do you understand the instructions? There are instructions for check-in and security and boarding and whatever else you're doing. Sometimes they're through technology, sometimes they're quite straightforward and they're printed, but they're often confusing. How do you have sufficient time and assistance to accomplish whatever task needs to be done? How do you and your care partner get treated with dignity? And then one more question, which I just added because this has come up through MSP. They want to know, are there sufficient places to sit when you are in the airport? And that can be any place in the airport. So if you have thoughts about that, please add them into the chat, and I'll take a look at those later. So I want to go back to this. How do you stop from being separated from your partner? Or what happens if you think you're going to be separated? And there are several things that you can do. One is to use your phone to take a photo ID of the person living with dementia on the day that you're traveling. So you have a current photograph that you can share with people. Another thing is to have ID cards. You want an ID card for the person living with dementia. You want one for the care partner, and You may want to have a third-party contact, because what happens if something happens to the care partner and you can't speak or take care of the person that you're caring for? There are examples of these in the Memory Minders travel kit, and I'll get to that in a few minutes. There also are ways to keep track of each other if you have smart watches. And I've been looking at some of that technology, and some of it has two-way communications, either audio or visual, but you need to be sure that the technology that it's dependent on works at the site that you are going to use it in. So if you're at the airport, there are some technologies that get inactivated because the airport has to be able to have all its technology function. So you need to be aware of that. And then if you are at the airport, there's something called the Sunflower Lanyard. And this is available from participating airports. MSP happens to be one of them. And you can get a lanyard which has a very simple card that indicates that you need some additional time or support because you have a hidden disability. You do not have to identify what that disability is. On the back side of that card, it will ask you to fill in your first name, a family or guardian contact, a phone number for them, and then any special assistance that you need. You can also get a fancier version of the card, and that's visible on this sign too. So those are things that you can use to identify yourself in the airport, but they are not recognized outside of the airport in the US. If you were in the UK, they would be recognized any place. So that's a whole nother discussion. Understanding instructions. It turns out that TSA, the airports, the airlines, all have assistance available to you, especially for people who have disabilities, who have hidden disabilities, including dementia. But it is incumbent on you to search out those services. And sometimes there is a time lapse required before the service goes into practice for you. So again, in the tools that we've put together for the Dementia-Friendly Airports Working Group, we have detailed information about that so that you can identify what services you need to research, how to get to those services, and then how to be able to use them, and what they will and will not do for you. And there are restrictions on what the airport or the airline can do for you, regardless of what your condition is. And that includes people with dementia. They cannot assist you in the bathroom. They can't help you change. There are many things like that. Other things that are available from the airports are maps. So you can find out where are there quiet spaces, where are the family bathrooms, where are service dog area, places for the dogs to do their business if you have one with you, where are there places to find food and such. All of that is on a map for any particular airport, but it is again incumbent on you to find where those maps are on their website. So that's kind of the ballpark for what you need to think about. The Dementia-Friendly Airports Working Group has put together resources for travel. And again, I've got the link to the webpage that starts on so that you can get to it. The first thing we have are what are the disability travelers' rights? So you can find out about that. And then the more important piece is the flight process from start to finish. And this is detailed information about what kind of research and what to consider before you book a flight, when you're booking your flight, how to prepare for arriving at the airport, going through security, boarding the plane, all kinds of things. They're very detailed sets of information. And then the next thing on that are the tools for travel. And we have many of these, and that includes lists of not endorsed products, but information about smart watches or traveler assistance programs or programs that already exist that TSA or other services make available to you. And that includes TSA PreCheck, which is very useful for people with dementia and their care partners to have, because it reduces how much time you have to stand in line to get through security. And security is a major, passing through TSA security is a major issue for many people, especially people living with dementia and their care partners, because sometimes you can be separated even though you shouldn't be, and they may ask you to follow instructions that are difficult for the person living with dementia to understand, process, or comply with. So all of that information is there. There are other travel tips, and we have information, we haven't taken it down, which still deals with COVID-19 air travel policies. So that's available on the website. Then we have this air travel kit. I'm going to go back first to the regular travel kit. The Memory Minders travel kit was put together by some care partners who belong to Roseville AD, and they have a number of things there that are worth looking at. You may or may not want to organize anything in all the little plastic baggies, but the information is very important. And one of them has to do again with suggested emergency contact card information. But then there's an emergency medical travel form. And that, if you look at that, you may find that that's very useful information because it collects information about your care recipients so that you have it in one organized spot whenever you're traveling. There are tips for appointments, which include medical appointments, local outings, extended travel. There's suggested a trip planner form and an itinerary and such. And then again, there's information about the sunflower lanyard. So all of that's there. And we took that and then expanded upon it. And we added information about air travel specific issues. So one of them are these Tepa Snow airport videos that I'll show a little of in a few minutes. One of them is a version of the Alzheimer's Association 10 signs. And it was written by a dementia specialist who is part of DFAWG. She's a nurse out in Arizona. And it is how dementia symptoms manifest at the airport. And that's a very, very useful document for you to look at before you go to travel, because it will suggest what behaviors you might anticipate, and then you might be able to think about how you could interact with the person who you are caring for so that you either minimize those behaviors or you are prepared to deal with them if they occur while you're traveling. Other things in this, again, there's more about the hidden disability sunflower, a list of what you might look for on an airport's website, an airline's website, and that's quite different. The regulations for what airports and airlines have to provide for people with disabilities or hidden disabilities is quite different in the United States than it is in other countries. So if you hear about something that's working in the UK, our air travel regulations are different, and you cannot expect that you will get the same behavior from an airport or an airline that you would if you were overseas. There's information about the TSA, and then there's a wonderful book, again, written by the same nurse who wrote the how the symptoms manifest at the airport. And this is a book suggesting things to do and how to organize things so that your travel with somebody with dementia is enjoyable and goes well. So that's quite wonderful. And then we have, I'm going to go back to the Tepa Snow videos. So this is a list of what's available on the videos, the different topics, and I'm going to change screen. I hope that I can do this and try to show you the videos. So, or one or two of them. Okay, so the story behind the videos, while I'm getting one of these lined up, is that members of the Dementia-Friendly Airports Working Group wrote these scenarios, and then Teepa Snow decided that it was worth her time to actually adapt the scenarios, have her team produce these. We got cooperation from Charlotte, I've just lost it. Anyway, from an airport in North Carolina, and they are also a part of DFAWG. And it's really quite wonderful to see this. So I'm just trying to decide which one would be best. And I think we'll just try this one because it's here. And I will try and maximize it. I hope that you can see it.
Next.
Hi.
Hi.
I'm supposed to be flying over to Dulles. And then over into to New York, and
what's your final destination, sir?
New York.
New York.
I
Do you know which airport?
I don't remember which
Do
airport.
you have your license so I could find your name? You know what? Why don't you step off to the side for a minute and I'll talk to the woman behind you.
But
and then I'll come back to you in just a minute, okay? Just step off to the side, sir.
Okay.
That's okay. That's okay.
Yes,
yeah. So you're Oh, okay. So okay. So let me get you in here. Okay. Okay.
thank you so much.
No problem. Okay.
Is it my turn now?
There you go. Do you have your license?
I need to find it.
Well, sir, if you could step off to the side and find your license, I can reach the rest of the passengers.
My care partner told me I'm supposed to be going on this flight, and what if I'm late?
I don't have a way to find you in my system.
But
I can't find you in the system unless I have your license. So please step off to the side.
My name is Richard.
Richard, I need you to step over to the side and find your license so I can get to the woman behind you.
But can't you use my paper?
No, I can't.
Is it
Next
my turn?
in line.
I can come?
Hi.
Hi.
I'm Amanda, and you are?
I'm John Richard.
John Richard.
Yeah,
okay.
I've got a boarding pass.
A boarding pass.
Yeah, I'm supposed to be at Dulles.
Oh,
and
okay.
I think my flight leaves soon, and I don't know where to go. And
you're not sure where to go. Hey, listen, I've got a colleague. Hey, Liz. Liz is a specialist in things like this.
But aren't you a specialist?
I wish I was half as good as Liz is.
I'll help you from here.
Here, step on right over
okay.
here, guys, and you guys can figure that out. Thank you so much. Thanks, Liz.
No problem.
I'll be right with you, okay?
What do I need, Liz? Do I need a...
There we go. Okay. Thanks.
I have my passport. Do I need something else?
Yeah, you'll need your ID for security, and then once we get through... we're going to A4.
Someone is in an unfamiliar environment. Time is pressured. It's a little bit busy, and things don't go the way we anticipate they're going. Then suddenly, information you should have available and you should be able to hold on to isn't working well, isn't making sense. So, having someone behind the counter who knows what's going on and that I need more support and has someone to call and give that support makes all the difference in the world. What it means is having a system that works That's what this is all about. Dementia-friendly airports create systems where people who are living with hidden disabilities, like dementia, get what they need. And so do the people working in the airport. And frankly, so do the other customers.
And I want to show you one other very quickly. This is, again, TIPA showing this. Let's see if it's working. Maybe, maybe not.
Oh, good.
Miss Snow?
Yeah.
Okay. Go ahead and have a seat.
We don't have a lot of time
No,
for this connection.
I've got a couple other people
Can
I've
you
got
pull
to pick
this up?
There.
There. That makes it easier.
Sure.
Okay.
Okay. Ma'am, I'm just gonna have to, here, let me put this back down.
Yeah.
I'm just gonna have to let you sit here for just a minute while I go pick up another woman who's running late for her flight.
Right.
So I'm just gonna leave you right here.
How long are you going to be?
Just a couple minutes. I just have to run
Okay.
2 gates over. I'll be right back,
All right.
okay?
Okay.
Just stay there and don't go anywhere. I'll be sure to be back.
Okay. Well, this is ridiculous. It's been 10 minutes. She said it should be 2 minutes. I've got to get going. I can't just sit here. I've got to get out of. How do I get this out of here? This is ridiculous.
Ma'am, what are you doing? I asked you to stay there. I came back. I was just coming back.
It's been 15
You need
minutes.
to sit down. It's been 3 minutes, and please go sit down so that we can get going. We need to go.
I'm going to miss my flight.
You're not going to miss your flight. It's only been 3 minutes.
It's been 10. 15 even.
Please sit back.
You're going to miss a flight. Nobody cares about anything. I know it's been 15 minutes. Unfortunate symptom for some people living with dementia is that time, how long, it gets really messed up. And so it could truly have been just 3 minutes, but for the person who's not sure and whose brain is changing, it can feel like 15, 20. It was an hour. It's a really long time. And so being responsive and being able to be okay with, oh, I'm really sorry, that took longer than I thought, even though truly it was 3 to 4 minutes. It's not about being right in this case. It's about acknowledging, wow, that part of the brain, it's called a hippocampus, isn't working very well. So being able to be flexible and being there for that person and not getting upset yourself is going to make a big difference. Yeah, airports are tough because people need to be places to get places. And sometimes people can get a little stressed about that sense of, I might not get there. So what we choose to do does make a difference.
Hi, Tipa.
Hi. Good. Yeah.
Amanda.
Oh, nice to meet you.
Nice to meet you. Here.
Boy, this is cutting it close.
It is cutting it close. I am
we
so
were late
sorry.
coming in.
I was watching.
Okay, so
If you consider going solar in
hold on.
Minnesota, but afraid of the huge price tag attached,
There we are. I'm trying to shut this down. Sorry.
most people don't know this, but
Nope.
almost 100%
Well,
of
maybe
Ford
not.
owners make the switch for $0 down. But there's a few things you need to know in order to see if you
I don't know
qualify
how to
in a
make him
solar
be quiet. I apologize. Maybe that's better. Okay. So here we are. Now I've demonstrated my ineptitude with some of this, and I just want to continue because I want to jump to one other thing, which is local travel, although some of it also applies to what happens if you are um, traveling at or to the airport. So Roseville AD has a collaboration with Silvercrest, and they have put together what they're calling staycations. They are descriptions of short trips that you can take locally, and they have, I think, 10 different locations, and they're wonderful. You can access all of the descriptions and the questions to ask and where they are at that site. But what they address, which is something that's applicable more generally, is to ask, how close is the parking? What's the walking level? Is it wheelchair accessible? Is there food and drink accessible? Do you need to bring your own snacks and drinks? What's the bathroom availability? Do they have family bathrooms or adult changing tables? Do you need to bring a change of clothing and or adult diapers or cleansing cloths? What's the noise level? And do you need to bring noise canceling headphones? What happens if the weather changes? What's your exposure? What's the activity level at the site? How heavily is it being used? Is it open to the general public or school groups? Are there special times for people with sensory concerns? So all of that is addressed either on these staycations, or they're just things for you to think about in terms of traveling with somebody with dementia. But there are two other things that are part of the staycations that are worth considering no matter what. And that's, what can you plan to engage your person living with dementia in this experience? How do you make it something that you both enjoy? So for the staycations, they suggest 3 sensory experiences to try at any particular staycation. And they also suggest 5 questions to ask the person living with dementia during the experience, so that, again, you're engaging them rather than just treating them like baggage. So all of that is really helpful. We think that it is applicable back to traveling either locally or in the airport to get to some other location. And with that, I'm going to stop and say there are several things that I'd like to engage you in discussion with. One is obviously ways to improve this presentation, but do you have suggestions for other tools or resources that you think DFAWG should develop that you could use? Can you think of ways to expand adoption of the sunflower lanyard? Can you think of ways that you might want to work with DFAWG? We meet every other month on Zoom for 2 hours, and our program development, our tool development is done by email, where we just share ideas and drafts and then come up with something that we may want to try out. So you don't have to commit a great deal of time, attention, travel, anything like that. And we are always looking for people who are living with some form of dementia or mild cognitive impairment, because we really want your voices in with everybody else who's working on that. And with this, I'm going to be quiet and stop sharing. And here we are. And yes, I have one of the sunflower lanyards on, and there is a version of it for people who are care partners, just so you don't have to wear the same thing. Anyway, there we are. So
our first question, I think, comes from Carolyn and then Teresa. So Carolyn, why don't you go ahead?
You know, I've been chewing about this. Wow. Am I coming across funny to you all?
No.
Oh, I'm in a huge room and it's really echoing. So I don't know if any of you have gotten those pocket lanyards at conferences where they have your name tag in the front and you can put a pen in there and you have a pocket, or if you've seen the travel lanyards that they wear around the neck. But I would recommend that this hidden disability card be put in that so it's seen. And then the license and the flight data is put in the pocket, because I did this with my brother when I traveled in March. Otherwise, they get to setting the papers everywhere and anywhere. And this was on his person in case we got separated, and hopefully it prevented him from losing his license.
Excellent.
So Carolyn, maybe talk a little bit about the lanyard itself. So if I pair what I know about the lanyard with what Carolyn said, perhaps you could take this pocket accessory and attach it to the sunflower lanyard.
You might be able to do that. Mine didn't have a little loop. It only had the strings. I like this lanyard because it's got the sunflowers all the way around, so it's actually really visible. But even if that was an additional item, I still would recommend potentially a pocket that's for travel additionally to put papers in. Sarah they may have talked about this at the DFAWG.
Well, you can purchase pockets and attach them to these. The deal with the sunflower lanyards is that they are recognized in over 90 airports in the United States, in close to 200 airports in more than 26 countries. So this is now the universal symbol for people with a hidden or non-visible disability. There are semantic arguments, depends on what country you're in. In the US, they think if we say hidden disability, there's something nefarious and you're going to blow something up. If you say it in the UK, nobody's worried about that. So, but this is the symbol. The sunflower is the symbol. It was just used in Berlin for the World Special Olympics back in June. I've just been told that the country of Brazil has adopted this. I'm not sure how they're going to implement it, but anyway, the point is that this is the symbol, and there's a little hook on the lanyard. You can also get the symbol as a little lapel pin or something else. I mean, there are other ways to use it. But if you wanted to use it as a lanyard, you could put a bigger pocket onto the hook. So thank you.
Great.
Yes, we have talked about it. There have been, people have been concerned that somebody might, on the one side, that you don't lose anything, and the flip side is that somebody might have access to your information and you would be abused. So, you know, there's always this, which is a stronger driver. But
so Teresa, how about your question next?
You're muted, Teresa.
I'm sorry.
That's okay.
Thank you. Thanks. I'm asking kind of a question about outreach, and I'm sorry I don't know very much about your organization and the group that you're leading, but what's been the process for outreach and implementation? So I'm wondering whether you've reached out to airlines to encourage their staff to be trained in this, or, you know, I don't know. I mean, I know Tepa Snow is famous, but I don't know whether there's some process for encouraging that. And then I'm also thinking about the volunteers at many airports at the info desk, you know. Okay. So I'm wondering about training for those different groups.
Well, Dementia-Friendly Airports Working Group is an international group. We've existed for 4 years. We've had surveys, and we participate in a number of different airports. We influenced Missoula, Montana Airport. They just built a new terminal, and they are implementing things that we suggest on our website to make them into a dementia-friendly airport. There is no official definition of dementia-friendly. And you need to recognize that, because it is a term that is being hijacked by various groups because they want to be, it's like accessibility. You want to be able to say for marketing purposes that you are fill in the blank. So what we did was to develop a working definition of what it means to be a dementia-friendly airport. We have shared that, again, internationally. There are a number of airports that are implementing portions of this. Some of our members are customer experience staff at different airports. Some of them are ADA civil rights people. Then we have people from whatever dementia advocacy group or such in our group. If you go onto the website, there's a ton of information. So there's been that outreach. Now, I have been appointed to some national committees. So there is an airport conglomerate airport airlines group that's looking at some issues, and I keep bringing up things from our perspective. There are other people from other disability groups who are participating in that. TSA has a group. We interacted with TSA back in 2020. The Dementia-Friendly Airports Working Group wrote best practices for security screening of people living with dementia. We got that through TSA. They distributed it to over 50,000 of their security operatives in the month of October. The trouble is that there's turnover, and you have, people disappear, they forget all kinds of things. So we keep working with them to increase that to, hopefully we'd like to see them get TIPA hired to make some training videos for their screening people, but who knows if that'll ever happen. But the point is that we keep doing outreach to these different groups. I participate for years now, excuse me, on Minneapolis, St. Paul Airport has a Travelers with Disabilities Advisory Committee. I share things. We were able to influence them to adopt the sunflower lanyard. Again, that was back in 2020. So it's pretty much hit and miss, and it depends on who you encounter and how long you hammer and whether or not they happen to have connections to somebody who's living with a disability or with dementia. And there's no uniform way to do this, and it would be magnificent if there was. In terms of just expanding the sunflower lanyard, I have approached all of the AAA directors in the state of Minnesota. This was several years ago, before COVID. Nobody picked it up. There was some interest, but everybody had competing things to work on. So that's a target. If you live near another airport, I have approached Mayo. We have been invited to participate for free in Mayo's Brain Conference coming up in November. And they're very interested in the sunflower lanyard. Mayo is the owner of the Rochester Airport. So we're trying to get them to implement this. Whether or not it happens, or if it happens in time for the conference, who knows? But there's St. Cloud Airport, there's International Falls, there's Hibbing, there, it goes on and on. So if you live near an airport and you know who is making decisions there, contact us. We'll happily share any information we have. But it got to the point where we're all volunteers, and the amount of time that it took to write all these individual cold letters saying, please pay attention, this is important, this is a great tool, for the return on time and investment, it was not worth it. So it really takes everybody working together and continually doing this. And speaking of working together, there was something that I forgot to tell you about, which is coming up. So I want to show you, if I can find it here, I think. Yeah, there we are. So the Roseville area Alzheimer's and Dementia Community Action Team is sponsoring more live talks again. So if you get a copy of the PowerPoint slides, you'll have this information, which is a presentation in August on TIPA's approach to dementia care, and then in September on local research that's happening. But we're also involved in a new effort with Mall of America and Minnesota AARP, and that's brand new. And we will have people starting in August who will be doing 2 presentations a month at the Minnesota AARP site. So it's another way to get the information out, but it's a very small audience. It's a hit and miss audience. And again, the question is, who wants to work on this and who can help? So that's where it sits.
So thank you, Teresa, for your next question about can we send out the links. Rachel will send out Sarah's PowerPoint presentation to everyone immediately after this call. So you'll get her PowerPoint, which, as you noticed, number one, has the link to all of those amazing resources. And I can't wait to get my hands on some of them. I love the rewriting of the 10 early signs. I'm looking forward to that. Anyway, you will all have the PowerPoint and therefore all of her links and the explanation of the resources you can get shortly after this meeting is over.
The access to the training tools and anything else is all on the website. And rather than my rewriting that, I suggest you go to the website and just go through the different chunks, and you'll see what we've done and who's worked with it and such. And then if you have questions, send me a question. Okay. Are you with GWEP? Okay, we have tried to get them to pay attention. Joe Gogler sends us his staff. We have people from his staff who've been involved in our things forever. We were just at the caregiver conference. I was promised that they would post things about this. I haven't seen anything. I don't know what's going on. I don't know what their time frames are. That's all I can say. You know, how many times can you ask the same person or a group of people to do something, and if it does or doesn't happen, then you just continue. So it'd be great to have it out there.
Sarah, contact me directly and I can make it happen.
Well, send me an email because I don't have your contact. The other is we have tried the Minnesota Board on Aging. We have tried the Minnesota Disabilities Advisory or whatever the large group is and such. You know, again, it's the accident of, is it something that somebody's interested in at the particular time that you get hold of them? And the answer so far has been not enough to make them do anything. So that's where it sits. But we'd love to see it out there. And having TIPA's videos is just the tip of the iceberg. I mean, because they complement all these tools that I told you about in 2 seconds or less, which are freely available to anybody. Now, MSP runs these desensitization events for people. Mostly it's for people with kids on the autism spectrum, but you can sign up for something called Navigating MSP once a month, and you go on a Saturday morning and you might meet a pilot and a few other people. They have the body of part of a plane. You can practice sitting on it and doing other, or in it, and doing other things. And we have tried to get them to work with us to do dementia specific training. That didn't go anyplace, but they are happy to link to our documents on the website, and they are printable. And so some of them are being handed out occasionally in their goodie bags to seniors who are coming on their Navigating MSP trips. That's probably a very, very small population, but it's a start. Again, that's where it goes. A lot of what we've developed is not just for people living with dementia. It is absolutely applicable to people with any other hidden disability and just to the senior population. So there it is. So yeah, get hold of me. I'll happily share stuff or talk with you. Anybody else?
Sarah, this is Megan. Can you hear me okay?
Yes, I can.
Okay,
Hi.
and I have audio issues, so I'm on two screens. But
Okay.
so, I've been doing this work for many years. This is really exciting to see how far this has come along. But now, on a personal note, I've started traveling with my parents my dad has uses oxygen, so that's a big deal when we're traveling. And so it's really neat to see the evolution of helping make airports dementia friendly. And I think we talk about this a lot. The effort put towards this helps a lot of different travelers. And so it's neat to see the way that you've woven in just hidden disabilities in general and this specific work. So I just want to say thank you and kudos.
Well, thank you. It's very interesting because I interact in some international dementia groups, mostly with respect to air travel. And so we share these with a group in Ottawa that's a research-based group, and also with British Columbia. And people are looking to see if some of this, especially TIFA's videos, are applicable, because again, they have different regulations, so it depends on the document. The person who was at the base of our deciding to do this is in Australia, and we have worked with her since we started. So 4 years of working with somebody who was responsible for Brisbane Airport. It's very interesting to see who wants to do something, and then how do you make it happen when you're subject to different regulations?
Right.
And so that becomes a complication, but it's, we're working around it. That's the best we can do.
Mm-hmm.
So
Melissa had a question. Melissa?
Yeah.
I was just wondering, this is great information, and I think somebody else had mentioned it, the idea that this isn't only outreach that needs to be done to the airports and the staff working at the airports, but also their caregivers who don't even know about this aspect. I mean, I while we were talking, went and searched on the Minneapolis-St. Paul airport, and unless I use those keywords about hidden disability or something like that, I couldn't find anything about it. So unless I know what to look for, we're not going to be able to get the people who need it to get that information out. So is there just a simple, I mean, I know you've got a lot of resources on the website, but just a simple handout, a little card, a business card, something that we can give people at outreach events to say, hey, have you checked this out? You can pass it around, kind of thing.
We have, I don't have it up on my screen. We have one handout that we used at Joe's conference, which basically has traveling with dementia, and it lists some of the major resources that are on our website, and it has the link to the website. And that's at the moment the most that we have. I've talked with Colleen, and there's an initial discussion now about adding this to the resources that are given to the dementia champions. But anything you can think about, anything you can help with is most welcome, because again, there's a limited amount of time and electrons. And so, yeah.
Melissa, you just gave me a flashback. I know that my whole journey as a caregiver, I kept saying, if somebody had told me what I needed to know, I'd have found that information, but I didn't know I needed to know this. Mm-hmm. And so that's my sense of desperation with this information. How many caregivers are out there right now that need this information? And so I'm hoping that we as champions can be one venue for getting that out there into the community. Go ahead, Sarah.
Well, I mean, even with ACT on Alzheimer's, I had approached Jen months ago and asked her to send out to the list of people who come to these things, would you send out something about DFAWG or this link or something about Roseville AD, because you can get from our web page there back to this stuff, and nothing happened. So again, the question becomes, how do we improve the way we share information so that it's not so burdensome on an individual who has something and more of us have access to it? And that I'll leave that question out there because I don't know the answer.
I think that's the $1,000,000 question. I think we all have that question and want that answer because there's just so much great information up there. And how do we sort through it?
Okay, Paula's telling me, Paula is our communications specialist.
Hi, Paula.
I'm certainly not.
Hi.
And, Paula, you want to say what you just wrote in the chat?
Sure, we can send a file to you of the one-page presentation that we put together for distribution at the Caring for a Person with Memory Loss conference. It has just basic information about DFAWG and its purpose, the main points of that are covered on the website, the sort of information you can get from that website, plus a QR code so people can scan the QR code and go directly to our website, or they can type out the URL. We provide that as well, but QR codes are really handy for that.
So let's try it this way so we can get it all done in one email. Rachel, are you listening to us now, or would you prefer that I send you a text? Rachel is going to be sending out the PowerPoint. If I can connect Rachel and Paula, if Paula could send that information to Rachel, then it could all come out in one email.
Yeah, I think Sarah has that file too, but I would certainly be able to send it.
Paula, why don't you send it so I don't have to find it?
Sure.
Okay, so Rachel is listening. Rachel, would you please send Paula your email address?
You can just put it in the chat if you wish.
Brilliant. Oh, I love Zoom. Who ever thought 3 years ago that we'd be so, look at how much we're facilitating with just the blessing of Zoom. So I want to wrap this up. First of all, Sarah, from the bottom of my heart, thank you not just for this presentation, but for all of the work you have done from the grassroots in making all of the changes you had for us as service providers and for people living with dementia and their caregivers. That is a mammoth job, and you have started to take a piece out of the elephant, and you are indeed making a difference. Our speaker for next month has not been confirmed yet, so as of now, I can't give you any information on that. Hopefully we'll get that locked in within the week, and we will send that information out. Is there anything else we can do for anyone in them? And if you have ideas, if there's something like Sarah's work, if there's something else out there that you think we all need to know about, please send me an email and let me know. Bye, Megan. And let's make it happen, because look at what we've all learned in this past hour, and look at the fire it has put underneath all of us in this last hour in order to help get this word out. Yes, Sarah.
I just want to say thank you for what you said, but again, I want to emphasize the work I've talked about is collaborative work. A whole lot of people in Dementia-Friendly Airports Working Group, a whole lot of people in the Roseville AD group. There are very few things that are single person items, and I want everybody to be credited. The other thing, because I see Mary Eck is on this, is to tell you that Jan Doherty, again, the author of How the Symptoms Manifest at the Airport and the traveling book, Jan and I wrote a sector guide. So that is on the Dementia Friendly America website. So it's an airport sector guide for what it is.
Good. So. Thank you. Thank you all so very much. I look forward to sharing and learning again with you next month. Thanks for all of your encouragement and your participation. Bye-bye.
Bye-bye.